gotten so much from Tina since we met more than a year ago. Our Gun Violence Prevention Coalition and others from the CCHI and others joined in the Mother's Day March for Peace for the last couple of years and had a great, energetic team this year in the chilly rain, which even made it more meaningful, I think. We're so happy to be even the smallest part of that and making sure that the vital work that you do continues. So please join me in welcoming Chapman.
Good morning. Good morning. Tell you, traffic is hell out there. Thank you both, Dr. Sachs and Dr. Masiaski, for your vision in co-founding the Center for Gun Violence Prevention. And I must say, thank you, Dr. Salvin, for making the investment. I know you guys know this, but the community person in me needs to let you know that I also know this. According to Dr. Deborah Prother Stitt's research, she says families of homicide victims are uniquely and deeply impacted psychologically, physically, emotionally, spiritually, and financially. Healing is essential to healthy and stable communities, she says. And I quote, "Experience teaches us that urban violence is only preventable if we address the underlying conditions that support it: racial and ethnic disparity, poverty, and marginalization. And these conditions are not tethered to the streets where conflicts are played out, but are woven through our day-to-day lives. And while addressing these issues is without financial cost, not addressing them is even more costly. In our prisons, emergency rooms, our physical rehabilitation, increase in public safety costs, and again, I want to thank you, Dr. Salvin, for making this huge investment in your hospital. For us at the Peace Institute, making sure that families are treated with dignity and compassion regardless of the circumstances surrounding their loved one's murder is at the center of this intervention. And we are pleased to say that we are partnering with our hospitals that are a part of this work, and it is a great investment. You see, when Lewis was killed in 1993, there were no resources, no protocols, no services, no procedures when responding to families whose loved ones were murdered due to gun violence, especially if you look like me. Over 2 decades, the Peace Institute has established stronger, more reciprocal relationships between families and the service providers, our medical professionals, our funeral homes, our law enforcement officials, our criminal justice professionals, and the stakeholders that as families we must encounter. We have also partnered with the late Mayor Menino's administration, our Boston City Council, and this partnership continues with the Walsh administration in creating a standard operating procedures in transforming the way we respond to families whose loved ones have been murdered in our city. And we are a part of making sure that every family whose loved one is murdered, whether it's on the streets or whether that they die in a hospital, receive the Survivors Burial and Resource Guide, a step-by-step workbook where families can begin to regain control. I just want to share with you a few thoughts on how a hospital like MGH can fulfill its goal for the center. But first, I want to share with you our ongoing collaboration with MGH through the VIP program. MGH was one of the original hospitals to be a part of the citywide partnership in 2006 in response to an increase in violence throughout the city of Boston. In addition to MGH VIA, Boston Medical Center also is the original hospital that has violence intervention and advocacy program. Kate has been here for 4 years, and she has been a great partner with the advocates in making sure that the families of murdered victims do not leave the hospital empty-handed the way I did 26 years ago, and that they are connected to community resources. advocate is here. She is one person. We know that there are gaps in services, and I'm going to pray, I pray daily, that there will be a great and stronger collaboration with the Gun Violence Prevention Center and the VIP team to make sure that no family leaves the hospital empty-handed and empty-hearted the way I did 26 years ago. In addition to the doctors that will be doing the research that will advance the health and safety of children and adults through injury and gun violence prevention, we are hoping that the center will also hire as part of their teams of individuals that have their pulse on the reality of what is needed that will help you to fulfill the education and community engagement as part of your center's goal. If you need help, check us out. We can guide you in the right direction. So the opening of the MGH Center for Gun Violence Prevention is a step in the right direction. Yet the reality is homicides are still happening in our own backyard. And yet, the Peace Institute is called to serve these families who have emotional, practical, financial, and spiritual need in the aftermath of homicide. Research tells us that homicide survivorship is under-recognized compared with the survivorships of other forms of violence. We are here to partner with you to train health professionals about the specific and unique impacts of homicide so that survivors of murdered victims can receive that care that is designed for them, for their well-being. Through our continued partnership with MGH, our hope is to be a part of bringing forth true, sustainability in communities in urban settings. Making sure that there is an equitable investment in community is our desired outcomes. More often than not, communities of colors do not benefit when these major announcements are made. And the struggle and fight continues for us for this type of sustainability. We are encouraged, we are hopeful, and we are here. Yet, great intention has to trickle down into the community. And we are looking forward to partnering with the center by being here to offer training that is culturally and relevantly appropriate. Again, I say thank you. Thank you to Dr. Sachs, Dr. Maciasco, for your vision. And thank you, Dr. Slavin, for really, again, making the investment in following the leadership of a survivor of a homicide victim. Thank you.
Thank you. Not hard to see why I've learned so much in that time. Right before I introduce our next speaker, Mark, welcome. I love you and thank you for being here. And I'm going to put everybody through just saying what I said already is that almost everything I do is following your lead. And I just thank you for that and for being here. And it's crazy traffic, we've heard all of that. I now have the amazing privilege of introducing our Attorney General, who's currently serving in her second term as the people's lawyer. Maura Healey leads an office dedicated to advancing public safety and protecting the rights of all Massachusetts residents. And the AG has really been at the forefront of this fight for gun violence prevention. I've had the amazing privilege of working with people in her office, John Miller, who's one of my personal heroes, who organized a group of physicians, and I don't know if you've ever seen one lawyer trying to corral 15 physicians in a room, but it was a sight, and John did admirably, trying to get clinicians on the same page about what we're supposed to be talking with patients with, and really organizing resources and supporting us to make that happen. So thank you to the Attorney General's office for her support so far. And on a personal note, the Attorney General has been incredible to my family. So I think it was after Mark was interviewed on NPR, I think the AG reached out and has been a partner in a lot of the work that Sandy Hook Promise does in bringing that work to Boston Public Schools. went down to DC and joined Mark and their family for the March for Our Lives. And if I heard the story right, it's the reason that Natalie, Daniel's older sister, got stuck backstage to meet Miley Cyrus. So really, what else could be said? A personal hero in my book. So without further ado, the Attorney General.
Thank you so much, Dr. Sachs. Come on up. Hey. See you. I wanted Mark to join us on stage. I think it is really poignant and beautiful when you think about tragedy and when you think about terrible things that happen to good people and how they seem to turn those events into a really powerful force. And I can think of no greater example of that than what Mark and his family have done. Dr. Sachs alluded to the Sandy Hook Promise program. We're really proud as an office to have worked with Mark and his team at Sandy Hook Promise to bring training on violence prevention, mental health services to over 140,000 students across Massachusetts. And it's a really, really great program. It's helping young people identify how to ask for help before they hurt themselves or someone else. And I think all of us today can't underscore enough and affirm the need for funding for behavioral health services. I see it all across the state. The need is great, and I think it's such an important program. And I wanted Mark to be here because he really has been so instrumental in being the driving force behind a lot of the initiatives out of our office. And he's joined by so many others as I look across the room. Some of you I was at Lena Park with in Dorchester on Saturday morning. Others I've had the privilege, I see Dr. James, nice to see you, over at BMC. We've talked about this issue in a number of contexts, but I just think that today's event is really significant because for so long we've talked about this as a public safety issue, and kudos to all the folks in police and the chiefs who are here, District Attorney Rachel Rollins. But the lens needs to have been shifted to what this really is, which is a public health issue. It's a public health issue, not just for the 200 lives that are injured every day and the more than 100 that are shot and killed at the hand of a gun, but the ripple effects of all those incidents on family members and the like. And that's why this is just so great, and I am so proud to see MGH do this. I am grateful to Dr. Slavin and his team, to Dr. Masiakos, to Dr. Sachs for all that's gone into this center. I'm really proud to stand here with colleagues who've worked hard on this issue. I think about Speaker DeLeo and the strong gun laws that we have here in Massachusetts. Strong gun laws save lives, and it's a credit to him and his colleagues for their work. I also find it really moving whenever I'm in the room with Tina, who just a few weeks ago once again led the Mother's March for Peace on Mother's Day and has been such an advocate and such an educator, an illuminator, as we think about how to deal with and break cycles of violence and trauma in our communities. My colleagues, Commissioner Burrell is here as well, and I know we'll be joined shortly by the mayor. There's somebody else I want to acknowledge, and she's busy getting after it in DC, but has been a great friend and partner to us. Congresswoman Ayanna Pressley has folks here today, and Ayanna has always spoken brilliantly about the impact of violence on our communities and what that breeds. So this is great to see the medical community come forward. This is your lane. This is your lane, so embrace it and make the most of it, because we really need you in the driver's seat. You know, last week I was out in Denver. We had a meeting with other attorneys general from around the country, and for the first time we had organized a survivor panel, and it was really, really powerful, you know, and to listen to a woman who who sent her son to a birthday party, 13 years old. He was in the right place. He was doing everything he's supposed to be doing as a 13-year-old, and a shooting happened there. And so he's left now in a chair, paralyzed and also unable to talk. And that mother not only has to worry about her son and what's going to happen to him for the rest of his life, as she cares for him every day, but she now has to worry about her now 15-year-old son, who was 9 when that happened, who is left with all sorts of trauma, and that hasn't been addressed. I heard from a woman, survivor, who lost her sister to suicide by gun, and also her father, and she herself now deals with suicidal thoughts and needs help, but she's a strong and brave survivor speaking up. Met with many folks who were survivors of Aurora and Columbine. I note that this Wednesday is the 3rd anniversary of Pulse nightclub. So many shootings, so many senseless deaths. But today is a positive, because today, I think, truly represents a step forward, recognizing gun violence as the public health crisis that it is, and recognizing the unique role that Massachusetts has to play nationally. We will continue to pass strong gun laws. We will continue to support and grow, hopefully, funding for behavioral health services. My office will continue to defend any number of challenges to those laws brought by the gun lobby in the NRA. And by the way, we have not lost a case yet over the last 4 years. So we're going to continue to do that work. But I think collectively, as a community, this is how we best achieve. And for an institution like MGH that has pioneered and led the way so much nationally, globally, to take this issue on, to create a center, to bring us all together, I know will have a meaningful impact on the lives and the trajectory of lives across this city and across this state. And I do think it's a model of what we need to see happen nationally. And as Massachusetts has led on so many fronts, this is a perfect place for us to lead. So I want to thank Dr. Slavin and the team here for all the great work that you're going to do. I want to thank my partners in this effort. And more than anything, I want to thank the survivors. It is your voices, especially the voices of the young people, that are going to continue to power and energize and move this movement forward, demanding with insistency action, especially on the part of elected officials like me. I now want to ask Mark to share any thoughts that he has, but again, thank you. It's an honor and a privilege to be able to work with all of you.
Thank you, Attorney General Healy. I do have a lot of thoughts all going around in my head in just a big mess right now. But most of it is hope and pride and appreciation for the great work. I have to just give all kinds of props to my sweet little cousin, Hannah Sachs, Dr. Sachs. You are a continuous source of inspiration for me, and I want to introduce everybody I know to you, because you're such a shining light of hope and optimism, and you can get things done, and we're watching that happen today. It's also an honor to call your great Attorney General my friend. We have known each other for quite some time now and have been involved in this fight together. But Massachusetts continues to be a shining light, a beacon of hope for smart, sensible regulations and policy around gun safety. And it's thanks to all the great work that's coming from your Attorney General's office and people like John Rosenthal and Stop Handgun Violence. And all of these people up on the stage here, and all of you people here, bringing the Mass General community on board, law enforcement. It is going to take a village, and I am filled with so much hope that families won't be having to endure the pain that our families will endure forever, thanks to the good work that's being done today by all these great folks. And Sandy Hook Promise is so proud to partner with the state of Massachusetts to bring our life-saving programs to the state to help you guys do this good work. So literally from the bottom of my heart, my little Daniel is proud of each and every one of you in this tent today. I just want to say thank you all, and we will continue to fight this fight, and we will continue onward. Thank you.
Good morning. Before we get started, I just wanted to say thanks to Joan Quinlan, the Vice President for Community Health at Mass General, Winnie Tobin, and Nessa Regan, who planned this event. And without them, this would not have happened. I get a lot of emails, some of them at 2 o'clock in the morning. Most of them in the last week came from them. But in reality, this is a remarkable show of solidarity from everyone. I've been a surgeon for the better part of 25 years, and there's some people in this room who I've trained with. Thea James from Boston City Hospital, we spent a lot of nights together in the emergency department. And others who I've met along the way, John Ma from the American College of Surgeons, who likes to say he's from the MGH West, Marin General Hospital in California, was one of the leadership at the American College of Surgeons. Thank you for coming today. I've been a pediatric surgeon for 15 years now, and all of them have been here. And I have the pleasure of working with some very great colleagues. Over the years, I've cared for many victims of gun violence, and I've told many mothers about the deaths of their children. I can assure you, Thea, John, that's the worst part of our job. As surgeons, much of what we know about treating gunshot wounds today, increasingly seen in towns across the United States, has been learned, unfortunately, from battlefield surgeons who care for similar wounds in Korea, Vietnam, and the Middle East. We have been trained to care for the worst traumatic injuries under some of the worst circumstances to save lives, and we are doing this well. However, many of my fellow healthcare providers believe that we are not only in the business of preventing death after injury. We also share a special obligation to better understand the causes and social determinants of these injuries and to prevent them from occurring in the first place. For this reason, physicians and surgeons have been champions of injury prevention for decades. We have not been alone. For example, although initially unpopular, Surgeon General Luther Terry, who was a pediatrician, reported on the dangers of tobacco to smokers, unborn children, and bystanders. This was followed by Surgeon General Siever Koop, a pediatric surgeon, who reported on smoking that provided a clear, evidence-based message to the American public that smoking can be lethal. These doctors' actions affected a significant change in the public's perception of smoking risks and led to legislation and cultural changes that not only validated their work, but also ultimately reduced the incidence of lung cancer deaths in both active and passive smokers. Using data obtained through years of government-funded research, doctors have educated the public and endorsed many other public health initiatives, including mandatory vaccination programs for children that have eradicated common infectious diseases, automobile modifications that have resulted in significant reduction in preventable deaths and injuries from the motor vehicle accidents that we used to see almost every day in our emergency room at Boston City Hospital that sort of have gone away in kids for the most part. Our approach to gun violence prevention should be no different. As you heard, in 2014, the gun-related fatalities for American teenagers matched the deaths resulting from motor vehicle crashes. Crashes are going down, and gun violence is going up. We should do more. When the rate of suicide by firearm continues to climb, particularly in our aging population, we should do more. Doctors, among others, can no longer afford to stand on the sidelines and allow the restriction of our ability to do research on firearm injuries while nearly 3 times as many American citizens are killed each year in this epidemic than they are by the AIDS virus. We can no longer delay while the cost to care for these victims exceeds the budget of the U.S. Department of Education. It's impressive. Our hospital-based center will join those who have worked in this space for many years to better understand the social determinants of gun violence. We will strive to provide educational opportunities for our patients and for our colleagues that will not only lessen the tolls on victims, families, and friends of the victims, our own healthcare providers, and tax the healthcare system, but will also provide cost savings that could be applied to other pressing healthcare needs. As healthcare providers, we are charged with more than caring for the sick and injured. We must all work together to address the gun violence epidemic that is indiscriminate of race, age, sex, or creed. Thank you very much. So the next part is easy. I get to introduce a friend. I like introducing friends. I like introducing Speaker DeLeo. Over the past 15 years, many of my colleagues have walked up to the State House to advocate on behalf of our patients. Our message centered around equitable and reliable healthcare access, smoking cessation, opioid mitigation, early childhood mental health, prevention and education, gun violence, and injury prevention. All of us have had the pleasure to work together with the legislature to improve the health care of the citizens of the Commonwealth, and several effective injury prevention laws have been passed. It started with Senate President Terry Murray, who's actually here today. And as a result of one day of advocacy, opened her door in her office to me so that I can come in anytime I wanted. We now know through evaluating the outcomes of these laws that many lives have been saved and many injuries have been prevented. Speaker DeLeo has always been one to welcome us. His thoughtful leadership was an essential force to produce some of the most forward-thinking healthcare and injury prevention laws in the United States, many of which have been modeled by other states. I'm so pleased that he has taken the time to join us today to share his thoughts about this important issue of gun violence prevention and what we can do together to realize a safer country for all of our citizens. Ladies and gentlemen, please welcome my good friend Robert DeLeo, Speaker of the Massachusetts House of Representatives.
Thank you so much, Peter, for that extremely kind introduction. And Peter is no stranger to my office. You never know when someone will come in and say, Peter Marciakos wants to see you. It's a very, very interesting relationship, but I thank him for that. And I thank him for that extremely warm introduction, and most importantly, for the unbelievable work that you do, Peter. Thank you. To Dr. Peter Slayman, thank you for your commitment on this very important issue. And to Connor Sachs, again, thank you for your, your leadership in making sure that we get something done on this most important issue. To my good friend, the Attorney General, Maura Healey, you know, with a record like she has in court, I wish she could transfer a little bit of that to the Red Sox right about now. I can't say that about the Bruins because they're obviously doing very well. And it's so wonderful also to have our District Attorney Rachel Rollins here. I know this is a very important issue for her as well. Commissioner Burrell, who I've had the opportunity to work not only on this issue but for so many issues. Thank you for your presence as well. And to Tina Cherry, thank you for sharing your personal stories with us and for really making a difference on gun violence here in Massachusetts. Thank you as well. I'd be remiss if I didn't personally also thank John Rosenthal. John is not only a leader here in Massachusetts, but I'd have to say he's a leader throughout the country on this issue. John and I, as we were involved, shall we say, getting involved with the anti-gun violence here in Massachusetts. We were in constant contact in terms of the ups and downs that one goes through during trying to get some legislation passed, but especially this one. And he was always there. Thank you very much, John. You're a true inspiration. As mentioned earlier, Senate President Murray, who I worked with very closely on this issue, it's great to see you here. By the way, Madam Senate President. Chief Guido from one of the districts that I represent, the city of Revere, who does everything day in and day out to keep our city safe. And I know that we'll be seeing Mayor Walsh shortly. But we are all here today because gun violence has threatened the health and well-being of our communities. And all of us here today are committed to continue our work addressing the issue and refusing to sit idly by. This Senate, which will surely become a leading voice on safety and prevention, is another promising step forward. On behalf of the Massachusetts House, I am here to tell you that addressing gun violence remains a continued priority for the Commonwealth. Meeting with victims from Boston and Haverhill and Lynn and Newtown and Parkland has had a profound effect on me, and I believe has driven us to action. The low rate of gun deaths in Massachusetts is no accident. We passed laws in 2014, 2017, and 2018 that are strong, and they work. Other states look to our laws as national models. We've closed gun sales loopholes, helped schools adopt safe practices, and we're the first state in the nation to ban bump stocks. Last year, and as part of a bipartisan partnership, we passed legislation to prevent individuals who pose a risk from owning or possessing a firearm. Our budgets build in measures to facilitate meaningful coordination with law enforcement and improve access to critical mental health services, including an investment in preschool through grade 12 mental health grants. Looking ahead, we're looking at how we can better trace weapons, deal with weapons and guns from out of state, and support ongoing efforts to ensure safe and supportive schools. We also need to focus on the root causes of gun violence, including in our inner cities. We need to think about expanding our prevention efforts, including addressing behavioral health and socioeconomic inequity, particularly in our urban communities. As many of you know, the disproportionate toll that gun violence takes in urban neighborhoods, and particularly on young people of color, is alarming. In 2017, teenage homicides in Boston doubled from the previous year. That's why last year the House passed a $10 million gun violence prevention programs for youths in areas with high rates of gun violence and violent crime. And last fall, led by Representative Tyler, we formally recognized youth gun violence as a public health epidemic. Representatives Tyler, Miranda, Vargas, and Cullinane are already hard at work on this issue. Legislation relating to firearms and supporting behavioral health among young people will be part of our discussion as we move forward. This session, we expect further conversation of what we can do in Massachusetts to build on our legacy of progress strengthening our gun laws. Welcome, Mr. Mayor. Thank you, Speaker. Nice to see you, pal. When you were in the house, you were never late for anything I had to say. But you're a big shot now, so
Good job. Keep going.
But I just want to say to all of you here today, and to all of the folks up here in the dais as well, I look forward to your partnership on this shared goal. Although I have listed many of the forward momentum that we have made here in Massachusetts, and I consider Massachusetts to be the strongest state in the country when it comes to anti-gun violence, and I think that our record shows that. But make no mistake about it. Make no mistake about it. We still have a lot of work to do. And this is going to be work, not for this session, not for next session, but for a long, long time. If we're truly going to make sure that we not only remain the top state in the country, but we take the word, what we've done in this state, and we see it replicated in other states and in our country as a whole. That's when I know that we have truly have won and have really combated this terrible epidemic of gun violence here in our country as well. So again, I look forward to your partnership on this shared goal. And congratulations to the folks from Mass General Hospitals, and I look forward to hearing the results of your work as well. Thank you all, and thank you all for your work and your support.
So our next speaker is going to be Dr. Monica Burrell, the Commissioner of the Department of Public Health for the Commonwealth of Massachusetts. In 2015, Monica was engaged in some very important work as the Chief Medical Officer of the Boston Healthcare for the Homeless program. She was on the staff here at Mass General Hospital, since we're one of the 2 anchor hospitals for that inspired program. And in perhaps one of the most inspired political appointments that I've witnessed during my lifetime, Governor Charlie Baker decided in 2015 to ask Monica to become the Commissioner of Public Health. And she has just done a remarkable job leading that important State Department, has looked for all sorts of opportunities to implement new policies, develop new programs to address key public health issues affecting the people of this Commonwealth. And so I just want to thank her for her leadership on so many important public health issues, including the one that brings us here today, and thank her for her being here today as well. So, Monica.
Thank you, Dr. Slavin, for that introduction, and it is an honor to be here with my fellow guest speakers. And most importantly, I am honored and humbled and inspired by the family members both on the stage and in the audience who are sharing their stories, and they are the ones pushing us to action. So thank you to the family members here today. Here in Massachusetts, we take great pride in being one of the healthiest states in the nation. And there's lots of metrics to prove it. We have one of the lowest rates of chronic illness in the country. We have low rates of obesity, lowest rates of tobacco smoking, and almost universal access to health care. And we take great pride in this. And when it comes to gun violence, in fact, we have one of the lowest firearm death rates in the country. But we know collectively, as you've heard from other speakers, we know that this is not enough and we must do more. And the metrics tell us why. Here in our state, gun violence is one of the leading causes of death for individuals aged 17 to 24, leading causes. And unfortunately, if you're a black youth in Massachusetts, you're 32 times more likely than your white counterpart to be hospitalized for firearms injury. We can and should do more here in Massachusetts. And at the Department of Public Health, we're taking steps to increase our efforts in a more meaningful way. Thanks to support from our legislative colleagues, for the first time, the Department of Public Health is explicitly addressing gun violence prevention through a public health and racial equity lens. We're helping communities scale their innovative violence prevention trainings and programs in order to have an impact across the state. Our focus is not just on treating the symptoms and the sequelae of gun violence, but on addressing its root causes, including the social and economic causes. Where you live or the color of your skin should not determine whether you develop asthma any more than it should determine whether you face premature death as a consequence of gun violence. At the Department of Public Health, we believe that health is a right for all, not a privilege for some. And we're actively working with community organizations to address disparities in neighborhoods with the highest rates of gun violence. And we're assisting them in developing programs that include housing, academic support, family support, employment, mental and behavioral health needs, and others. All factors that can make a difference in whether a young person is exposed to gun violence. I really want to thank Mass General Hospital for taking this critical step in developing the Mass General Center for Gun Violence Prevention. We're grateful to be a part of this exciting partnership, and I look forward to what we can all do together. Thank you.
Our next speaker is Suffolk County District Attorney Rachel Rollins. Rachel was elected into her office in 2018 and sworn into that office on January 2nd as Suffolk County's 16th District Attorney, the first woman ever to be elected as District Attorney of Suffolk County, and the first woman of color ever to serve as a District Attorney in the Commonwealth of Massachusetts. Thank you. Rachel was elected on a platform of substantial reform to the criminal justice system, which it surely needs. She pledged and has vigorously pursued since she took office a mission that's tirelessly focused on reducing incarceration, correcting racial and ethnic disparities, adopting alternatives to traditional prosecution, focusing the office's limited resources on serious and violent crimes, and improving relationships between law enforcement and the communities they serve. We know how important gun violence is in Suffolk County, and we really appreciate the leadership that Suffolk County District Attorney Rollins has taken on this important subject, and it's a great honor for us to have her with us today and to ask her to join us at the podium.
Thank you, everybody. I want to echo the thanks to my fellow speakers, but most importantly to the survivors in the room who have experienced trauma, the likes of which we couldn't comprehend unless you've actually lived through that. I've been in the office of the Suffolk County District Attorney for less than 6 months, and my count is 17 homicides since I've taken office. 14 of them have been with guns. Commissioner Gross, who I have the pleasure to serve with, he's the commissioner of the Boston Police Department. I'm also joined by Chief Guido, who I have the pleasure of working with and revere. But Commissioner Gross and I in Boston show up on most scenes, and we are fortunate to have a mayor that shows up often as well. And what I can tell you is to echo our wonderful Attorney General, this is a public health epidemic. It's a crisis. These numbers tell the same story that law enforcement knows. Guns steal more lives than any other weapon combined. And that number doesn't even begin to quantify the harm that gun violence inflicts on communities. And we have families that are left to live not only with the tragic loss of their loved ones. If you survive, you're lucky enough to survive a gunshot wound, the physical impacts of those wounds are extensive. The post-traumatic stress disorder is real. And we have communities that suffer as a whole as a result of violence. Children in certain communities are forced to grow up with the fear that the next step that they take outside of their front door might be their last. And I want you to hear me say that there's no hierarchy of hurt. Anyone who suffered a loss as a result of gun violence is suffering a tragic loss. I want to remind this room, however, that there are young black and brown men that die every single day on the streets of Dorchester, Roxbury, Mattapan, Jamaica Plain, and Chelsea, and we don't see the news there every day. I am proud as the District Attorney of Suffolk County to work hard on wanting to focus on survivor services. Our victim witness advocates, which many of you know, are there to assist a family that has had a trauma or a loss, not just from gun violence, but a sexual assault or any other violence, with the process of how to work through the legal system, which is very complicated for even some people who work in it all the time. But our most exceptional victim witness advocates also help you with all of the other things that happen when you suffer a loss. What I want is our victim witness advocates focusing on helping you through the legal system and our survivor services to help you with everything else. It shouldn't be that if you suffer a loss from a gunshot wound and can afford psychiatric help or mental health assistance, you get it, but if you are impoverished, you don't. It shouldn't be that if a gun violence impacts you in your home and you can afford to move out of that home and not have to walk over the threshold of where you picked up your loved one's body or seeing the stains from the blood there, which I have seen in the streets of Roxbury, Dorchester, Mattapan, that you can move, but somebody who can't afford it can't. We want to work with Section 8. We want to work with different organizations to make sure that these survivors get to have a full life and put their lives together. So what I want to tell you is I'm grateful to Dr. Peter Slavin, Dr. Peter Maziakos, I think is how you say it. Yeah, I did it. Dr. Sachs, and to Mass General Hospital as a whole for their leadership on this issue. With today's launch of the Center for Gun Violence Prevention, I want you to know you have a partner. For anyone in the media, you know I am a loud and active partner. So I'm going to be loud and active with you. We have a lot of work to do. Thank you very much.
Batting ninth and the last batter in our speaker in our lineup is none other than the mayor of the city of Boston. One of the great joys of my job is the professional relationship that I've developed with the mayor, as well as the personal friendship. I first met the mayor about a week after he took office when he called me and asked, and this was about 9 months after the marathon bombing, whether he could come by the hospital a few days later and meet with our clinicians who played a role in treating the victims of that bombing here at Mass General. And sure enough, a few days later he did come, spent about an hour with a group of doctors, nurses, and other staff, and asked them questions about the experience, and most importantly, just thanked them profusely on behalf of the people of Boston for what they did, and also inquired as to whether there were things that the city could do even better if we faced a similar situation in the future. That experience meant a lot to me. It meant even more to those doctors and nurses. It demonstrated what a big heart that our mayor has, how deeply he cares about the people of this city. It also demonstrated to me how much he values the institutions that serve the people of Boston. And in the case of hospitals, institutions that play an important role in addressing the healthcare needs of the city and serving as an important social safety net. So be it on the issue of healthcare disparities, veterans' health, substance use disorders, or today gun violence, Marty has just been an incredible advocate for steps that can be taken to improve the health of the people of this city. And it is a great joy for me to welcome Mayor, my friend, Marty Walsh.
Thank you, Doc. And I want to thank Dr. Slavin and everyone at Mass General Hospital who is constantly trying to find a solution for so many different issues that affect our city, that affect the people in our city, that affect the people in our country. I want to thank you. I want to thank the Harvard Medical School for your generous support as well. To Tina Sherry, the work that Tina has done, and other survivors in this room, and other advocates in this room. There are a lot of people in this room that do a lot of work in this area of violence and gun violence that might have not lost a family member, but lost a friend, lost a neighbor, lost somebody. I want to thank you for your work as well. To the team that's here, we have with us today Monica Valdez-Lupe from our Public Health Department in the City of Boston, Marty Martinez from Chief of Health and Human Services, Greg Long, the Chief of the Boston Police Department, is with us, Chief Revere is with us, Commissioner Burrell from the state, Attorney General Healy, all of these folks that are here. We work together. This isn't about who gets credit for what. This is about how do we move forward. To all the survivors of gun violence, whether you're from Boston or you're from anywhere else, we just want you to know that we hold you close in our hearts. The work that we do is for you, and I want to thank you for being here today. You are certainly a motivation behind all of the work that every single speaker that got up here and spoke today. You are the motivation for that. If you want to see what gun violence prevention looks like, it's here in Boston. With our health care, with our government, with our grassroots organizations and grassroots organizers, all the residents pulling in the same direction. I sincerely thank MGH for being out front on this issue. They've been a leading voice in the movement to talk about gun violence and explain gun violence as a public health crisis. When the NRA told the medical community to stay in your lane, the medical field said, this is our lane. Our hospitals and health centers are ground zero. You face it every single day. You've seen the effects of the health of a family and communities, and you're also a big part of the solution. So I want to give a shout out. I know I see at least one doctor here. I want to thank the doctors and the nurses and the medical staff that do incredible work here in our city and all across America as well. This new center builds on MGH's focus on prevention. You believe in looking for the root cause of the health issue, improving outcomes and outreach through education. That's how you approach substance abuse disorder, that's how you approach mental health, and that's certainly how you approach gun violence. You're a strong partner in our city in all of these regards. Focusing on prevention is one of the most important things we must do. We must be proactive and not reactive. That's the vision that guides our work in our city. We're looking for ways to prevent violence in the first place and stop the cycles of violence. We've made some progress. Violent crime in Boston has gone down significantly over the last 5 years. It's because we believe in lifting people up and not locking people up. But we know our work is, we're not satisfied. But I want to thank some amazing partners, people like Tina Cherry at the Peace Institute, visionaries like Dr. Peter Slavin, change makers like Speaker Robert DeLeo and Rachel Rollins. I'm proud of what we've accomplished, but we also have still a long way to go. One gun death is too many, and we won't stop fighting until we get to zero. And that's what we are. We're working to zero. We're working to create more opportunity, more positive opportunities for our young people. We're addressing the quality of life issues that make people think about firing a gun is the best option. We're investing more in trauma. We're dismantling prison-to-pipeline programs with creating programs like Operation Exit. We're putting a stronger focus on mental health. We're preventing gun violence in a big way in our legislative package. The speaker spoke already. I remember when I was a member of the legislature, and Speaker DeLeo put together the toughest gun laws in the United States of America. And then what did he follow up? He followed it up with the toughest gun law package in the United States of America. And he certainly is on the front line making sure that the legislature and the laws of the Commonwealth are helping people. We're filing a bill this year that's going to help us require doctors to ask patients about guns in their home, just simply to be able to assist those folks that have guns in their home when doctors ask them. together, and when I say together, I'm not talking about legislators and elected officials. Together, the entire community, we're finding a better way forward. We need to continue to stay creative, and a lot of efforts are working. We're in a position to set a national example. At a time when our country is in crisis, this leadership has never been more important. This center is another big jump forward, and I know it will have a big impact. I want to thank everyone who took time to be here this morning. I want to especially thank the professionals that do this work every single day. Thank you for your work. And to the survivors in this room today, I want you to know we love you, we stand with you, and we will always stand with you.
I want to just close the program by thanking all of our speakers for their wonderful remarks. I want to thank all of you for being here. Funding the center, announcing it is the easy part. Now the hard work begins in trying to maximize the impact this center can have on the issue of gun violence prevention here in this region and more broadly. And I know that Peter and Kana look forward to working with all of you to try to really make this center have a big impact. We know we can't do it alone at Mass General, far from it. We need to work with others in the private and public sector to really move ahead this critically important issue. And I know survivors and people throughout this region are expecting nothing but our best effort in going forward. So thank you so much for being here.